अब बिजनेस का जो क्या का करंट अकाउंट तो चाहिए ना एसबीआई करंट अकाउंट से सिंपलीफाइड बिजनेस आता है और प्लीज मतलब एसबीआई देश का
Hi, good morning, good afternoon, everyone. Can you hear me?
Yep.
Hello, good morning, good afternoon. Can you guys hear me?
Yes. Yes, sir, we can hear you.
Oh, perfect. Apologies, I joined the wrong meeting. I was wondering why there are no audience there. So a very warm welcome to this preparatory meeting for EDAIC Part 2. My name is Danish Siddiqui. I'm one of the persons coordinating these courses and these meetings. Along with me, we have Dr. Amrita, Dr. Dikshita, and Dr. Anwar, who are with me here as well. And we've actually just finished a almost 3-hour session this morning. So if we don't look very fresh and awake, there's a reason behind it. So once again, this is welcome to the preparatory session. The purpose of this session today is to give you a sort of an insight into how to prepare for the exam next year. What are the things that will come in handy for you? How to fix a timeline for your preparation, resources to use, what strategy to use, what is expected in the exam, and things like that. So whatever we can guide you with from our experience, we'll try our very best to guide you here. We have been doing these courses since 2018, so we have 5 years of experience at least of running the courses, and I have been actually attending these courses for FRCA and FCI since 2005 onwards. So I have a slightly longer experience. There's a reason why my hair are gray. So I have been attending these courses in UK, and the preparation strategy for the Western exams is very different from what we have in the Indian subcontinent or in Middle Eastern or Egyptian exams. So that is where we will be coming from. This session is not a monologue. So what we will do at the end of the presentation, we will have a session where we can interact and answer your questions. But during the presentation, I would request all of you to stay muted, and you can post a question on the chat box and one of us will be answering you there. But during this, just muting everyone. During the session, I would please request everyone to stay mute, please. Fabulous. So I'll start with the presentation first. Okay. Right, so preparation tips, as it's called. Let's have a look at what sort of time scale are we looking at. Everybody is different. I mean, some people who are regularly into reading and have recently done exams within the last 1 or 2 years. By exams, I mean viva exams. For them, probably 3 months is more than enough. But most of us who are either have not had exams, or because of the social circumstances, we are at a stage where working full-time, looking after a family. It's not easy to, close yourself in a room and study for 10 hours a day. In that kind of a scenario, I would say easily 4 to 6 months of work is needed. Even though you might have done your EDAIC 1 exam last year or this year, but still you need a completely different skill set here. And you need to give yourself at least 4 to 6 months of preparatory time. Now, books-wise, although we do not recommend any specific book, but we make you aware of some of the commonly used books. Our philosophy is you need to cover topics that are asked in the exam. You can use any book, any resource that you find helpful, but make sure you have covered those important exam topics. And those exam topics are available in abundance. If you go to a Telegram group, which has EDAIC 2 content in it, you'll find hundreds of posts with questions, question banks from EDAIC 2. And there's very limited questions that one can ask in an anesthesia exam. Although the style of asking the same question may vary. They might, frame it in a way where you have to first understand the question and then start answering the question. So that might be different, but basically the questions are predominantly the same questions. There have been recent change in the exam pattern, but I'll come to it a bit later on in the session. So MasterPass is one of the most common books that you all are aware of. I'm sure you have read this book. It's quite comprehensive, covers a good chunk of the exam topics. And yeah, we would definitely suggest it's one of the good books. Dr. Podcast is another very good book. Both primary and final FRCA podcasts are quite good. Now, this exam is very typical in a way that you have to use not just audio aid, but a visual aid. By that, I mean that you're expected to not just deliver oral answers, but you're expected to draw stuff like graphs, chemical structures, diagrams, things that explain that you're understanding better, things that demonstrate to the examiner that you comprehensively know the topic. And the other reason for drawing these or using visual aids is that sometimes the other examiner may not have English as their first language. So by using a diagram, you're eliminating that barrier, that language barrier in between. So it's always a good practice to use diagrams, graphs, any visual aid possible and for that reason, this particular book, Emma Plunkett, is exceptionally good. There are certain other content which we can share later on, diagram or things like that, which are very important. They have a number of diagrams. So that is, I would say, is another very, very good resource to practice diagrams. So that comes with as the main book, but reference books, we would recommend Oxford Handbook of Anaesthesia, always a very good resource for clinical questions, which I think wherever you have a clinical scenario, always double check that scenario with Oxford Handbook of Anaesthesia. You'd not find any controversial stuff. At least if you deliver the question, the content mentioned here, you're likely to get through the question. For pharmacology, now it's very, very common. We've seen it time and again in most candidates that we've got very remote knowledge of pharmacology. We know very specific things about few drugs. Secondly, the basics of pharmacology, the pharmacokinetics and dynamics, those are the areas which are very weak for most of the candidates from the Asia and North African community. And the reason for that is we've actually ignored these topics since our undergraduate days. So it's very important to know a good deal of pharmacokinetics and pharmacodynamics. They probe you really deep into those areas. So this is a very, very good book, Peck and Hill, which is highly recommended. It's both for this exam and for later exams for primary FRCA. It's a very, very good book. So that's one thing to remember. And Simon Bricker's Viva book. It's a very remarkable book. I've seen some questions directly picked up from this asked in exactly in the manner as given in this book. So these are the three main reference books. There are, I mean, there are lots of other books. If you have time at hand, if you have 6 to 8 months of preparatory time, we could suggest a lot more, resources. But I would just stick with these. Strategy. That's a very important thing. How do you use the time between now and your exam? The exam starts in March, and most candidates are likely to book the exams somewhere around July, August, and more so people try and book September, October, and November slots. That's what we've seen very, very commonly. We've hardly seen anyone booking exam in March and April. Very few of you will be, daring to use the early part of and there's absolutely no harm in actually getting the exam early if you feel you're well prepared. So with the preparation strategy, now we have mentioned many books, but it doesn't mean that you complete the reading of these 3 to 6 books and then come to start the Viva practice. As you have, as you notice that you would have read the topic 10 times, and if we start asking you questions on that topic, there will still be a lot of gaps in that area that we highlighted when we have the Viva session on that topic. And the reason for that is you might be passively reading and revising that particular question or that particular topic time and again, but that gap remains unfilled, and you can only fill it when it becomes highlighted. And that's the reason we suggest start Viva practice as early as possible. It's very important that as soon as you start your reading, don't wait for finishing, the whole thing again, the whole syllabus again. Bear with me for a second. Let me just minimize the window. That's fine. So don't wait for finishing the whole syllabus once and then going for the Viva. Some people say, let me make my notes and then start. I think these are all very, very traditional methods, time-taking methods. You don't have to feel very much like 100% confident before you start your Viva practice. You build up your confidence when you are actually doing the Viva. I know candidates actually who are exceptionally brilliant with their theory. And if you ask them a topic in their own time, in their own space, they will tell you they can write a book on that topic. But the moment you start, questioning them on that topic, that's when they start to fumble, and that's when they start to sort of become very reluctant. I'll give you a very interesting example here. I'm sure you all know Usain Bolt, the famous athlete who's the fastest man on the earth. I don't know whether he still is, but up to a couple of years back, he was the fastest man on earth. So if you put him in his racing lane and you fire the shot to start the race, there's no way anyone can catch him. He'll go straight to the finishing line, darting, as long as he's in the same. Now, what he attempted, he thought, because I'm so fast with my speed, and I can play football as well, then I potentially have a career in football as a footballer as well, because there's no one who can catch me when I'm running with the football, and I can straight away dart the ball into the goalpost. That didn't happen. He did try. He failed miserably as a footballer. The reason being that here you are not running in a straight lane. You have to navigate yourself through other players. You have to dodge. You have to make maneuvers to change your strategy. And this is exactly what happens in a Viva. Even though you know a topic, but you're not given a straight track to just keep giving a monologue. the examiner will make you move left, right, up and down, and you will really think, oh my God, I didn't realize that I knew this topic that superficially. The way they're probing me is making me uncomfortable and underconfident in this. So this is exactly what we build you up for. We start asking you the same basic topics, like very simple topics, pulse oximetry. You may have read it 100 times. You will be able to give the principle. It's Beers-Lambert law. You may be able to give the diagram of absorbance spectrum and all that. It's isobestic point and this and that. But when the questioning starts and you start asking, okay, what is the, can you measure hemoglobin content with the pulse oximetry? Can you do this? And you start asking questions, trying to check your comprehensive understanding of the principle. That's when you start thinking, oh, I was clearly missing something. That's why I recommend that you start vivas as soon as possible. Now, there are different ways of, not everyone is free. We do our viva sessions on a weekend, and these are interactive viva sessions. But what I recommend, and I know a lot of you would have actually purchased that viva content. There's a pre-recorded viva course. Basically, it's called Viva as Observer. These are all vivas, about 150, 200 vivas, which have been done in the last 2-3 years. And it covers the entire spectrum of your syllabus. Everything in the syllabus that you have, it's there. It's very unlikely that you'll have questions asked from outside. That maybe 1 to 2% questions, but not more than that. What I recommend that as soon as you start reading, pick up that section. And if you're reading physics, pick up the physics section and open up a viva. When you play a viva, keep a pen and paper with you. When the question is asked, start making your own bullet points on that question, and try and practice your recall method. How well can you recall on that topic? So it's very important to practice your recall as good as you can, because this happens in a lot of people. They had read the topic maybe 2 months ago and they can't recall it now. But if you start practicing your recalling ability, your recall will become much more stronger. All your neural tracts, which will help you in recalling, will become more activated, and you will find yourself having a very good recall of the topic. Because this exam is a very fast-paced exam. You will be asked in those 20-25 minutes, you could be asked easily about 15 to 20 questions. Now, to answer those 15, 20 questions, you have about a minute to answer one question. If you spend 10 seconds to 15 seconds on actually gathering yourself, putting up starting a response which looks decent, you've actually wasted about 20% of your time already in that. And if you have a good recall, then you start from the word go. The moment the question is asked, the recall helps you. It's like an example of an athlete. When the gun is fired and if your start is quick, you take the advantage straight away. So I would suggest that you start with that viva. Keep a pen and paper handy. When the question is asked, it doesn't matter if you don't know the topic comprehensively. Write down what you know about that topic. And once that particular viva is over, then check what are the areas you need to brush upon. What are the areas that you missed? And go back and read don't go to big books. I would suggest go to very quick reference books like A to Z of Anesthesia and Intensive Care Medicine. Open that topic and quickly recall from there, pick up the areas that you missed out and try and remember them next time you have the viva. The topics will be repeated. Those viva topics might be repeated after a couple of weeks. And that will help you remember that, okay, those are the areas I missed on in the first instance, and I remember them now. So you can actually keep a track of your own progress, how well your recalling ability is getting better. So that is what I'd highly recommend, that when you start reading, almost at the same time, start listening to the vivas, start practicing your recalling ability. This will take you easily about up to 3 months. Once you've finished those 3 months and you've completed about 70 to 80% of your syllabus, at that point, I would suggest you start getting into the interactive vivas. These interactive vivas, they are basically one-to-one, not one-to-one. It's a group of about 8 to 10, 8 to 15 people. And one person gives the viva, other people observe. And at the end of the viva, you are given a feedback. It's a test of your nerves, because you're sitting in a closed space without anybody bothering you, without any discomfort, and you're just giving an answer. Here you have about 8 to 10 people. Now this is a test of your nerves. How well can you hold yourself when you're answering to in front of an audience? So that is what we recommend closer to the exam, when you have about 2 months left in the exam, 2 to 3 months, because these are not vivas which take place every day. These take place only on the weekend. So start these vivas closer to your exam and build up your confidence there. That will be your final test of steel, or your steel test. That are you resilient enough to face the examiner? Do you crumble under pressure? Because the manner in which we do these vivas, when you come into the vivas as a new candidate, we are very gentle with you. We handle you with care. We will give you easy questions in an easy way. We will build up your confidence. Once we see your confidence growing up, then we start testing you. Then we start firing slightly more trickier questions. We start becoming difficult examiners. The purpose of that practice is to really build you up. So when you go to and face a difficult examiner, nothing stops you from performing. So that is what I would suggest in terms of the preparation strategy. It's very important that you have the right strategy. Don't leave your preparation till the very end. Don't think that, oh, I have my exam in October. Maybe I'll pick up the books around August or July, August time. No, I wouldn't suggest that. The pressure will start to mount on you. If you have your exam in October, make sure you pick up your books probably in March. Don't leave it to that long. Have a gradual introduction into the subject, and keep sort of even if you do a weekend work, that's enough. But start a little bit earlier. In terms of booking your exam, I'm going back a little bit. The dates, exam dates come in and go away very quickly. So it's very, very important that you should have a plan. What part of the year you're going to be sitting the exam, early in the year or later in the year. Secondly, go back and do some internet research about the locations. What are the locations? Most people would prefer to give an online exam. A few people would prefer to give face-to-face. I'm sure they will have many online exams next year, because it's convenient, it's cheaper, it's easier for them to organize as well. So have an idea about what are the times, what are the centers that you want to give the exam in. Secondly, when you're booking the exam, be very mindful that you choose the right language. This exam takes place in multiple languages. Don't book an exam in Spanish if you can't speak Spanish, or German if you can't speak one. Make sure you have written English, you have chosen English, because it has come to our attention for last few years since the online exam started. People had booked their exam in wrong language, and then it was a disaster. They had to be rebooked, but they couldn't get the same date. They were booked in March. As a result, they were shaky. Exam dates open in January. Between January and March, there wasn't much time. They couldn't prepare, and they failed. So one small mistake can result in failure. So be very particular about your dates and your language. Okay. Again, I've already touched on this part. It's very, very clear when you're sitting in MCQ exam, you do a lot of MCQ practice. A lot of MCQ practice will give you an idea about pattern recognition. Your MCQ sense will develop. Similarly, when you sit for a viva examination, don't just read text. Start with viva preparation, because you need to develop a viva sense, a viva strategy, a viva savviness. So that's really, really important that you develop your viva skills very early on. Okay, now I'll just share a survey. This is not from your batch, but this is from the previous batch. We asked about 60, 70 people. We asked them what contributes most to your result in terms of a negative result or a positive result. And these were the 4 options: lack of revision time, lack of viva practice, poor access to appropriate study material. They didn't have any clue which books to study, and they just got information from whichever book they were reading. And lastly, the communication issues due to either accent of the examiner or technical glitches, anything that interrupts your communication. So what's your guess? What do you think? Lack of revision time, lack of viva practice, poor access to study. What would you think would be the single largest reason for not being successful? You can write it in the chat box. Put your answers, and let me see if I can see your answers. You can write A, B, C, D. So A is lack of revision time, lack of viva. A and B. And B, time practice, lack of viva practice. B. Yeah. Yeah. Interesting. Yeah. Yeah. Some of you have probably given the exam before. I'm gathering from the names and from the responses. Okay, lack of revision time. Okay, fair enough. Let me share with you the result from the previous years. So a lot of people said revision time. Yeah, and very few people said lack of viva practice. But in reality, it was the candidates who had actually failed, and we asked them, and their response was opposite. 70% of them said it was the lack of viva practice. I wish I had started the viva practice maybe 2-3 months ago, and it would have been a lot more better if we had done that. So that is that's the thing from that survey there. I will just share with you some of the videos of our vivas, so it gives you an insight into as to how the vivas look. Any questions, by the way, so far? I mean, you can unmute yourself if you want. Okay. Right. So let's start with some videos here. Okay. So that's a video from very recently, and have a look.
What is coronary perfusion patient? Coronary perfusion patient resulting in aortic
aortic diastolic pressure minus LF ventricular in diastolic pressure.
So how does IABP help this?
Is aortic diastolic pressure it helps.
Yes, by? Is it by the inflation or is it by the deflation?
There's my inflation.
Okay, so the inflation increases the
Show you another one.
repeating syndrome. Basically, what you manifested was an electrolyte abnormality. So what do you think of it?
She is for the right person. I taken the particular date, and the ECG showing same date. It is a 12-day ECG, and the rate of the ECG.
Another one with the familiar face.
In ATLS, for those of you who have done ATLS, they can show that when they're assessing you for airway assessment, they would like you to comprehensively attend to airway before you go to breathing, and so forth, so on. So that is something which I would like you to practice.
What happens if you put your this thing? If you want to put your probe on the lower side of the lung, like in the posterior axillary sac at the liver junction, which we recently saw as the curtain sign, and you put a M mode here, M mode. Okay. Again, this is your lung, this is your diaphragm, this is the spleen, and this is your kidney. This is on the left side. The good thing, what you can see here, can you appreciate some hump type of structure? There also I mentioned this is the spine. Presence of the going down, some curtain type of things is coming and going back.
So this is quite important here, that they have started asking you questions on ultrasound, POCUS, FAST. All these are recently introduced topics. So it's very, very important that these these questions you're well rehearsed with. So that's why I've included them in the presentation today. That Dr. Amrita and Dr. Dikshita, they're exceptionally good. They've done all their exams, FCAI, EDRA, very good, very well trained in handling image questions. So they will give you such an exceptional practice on these topics that you will the examiners are just exhilarated by a response that a candidate has given such an exceptional response. So it's these are certain newer topics that are introduced, and you need to have a good awareness of this. Don't be surprised by looking in the exam by having an echo, transthoracic echo image, and wondering, I had no idea that there were these kind of questions were being asked. So that's the bit I was going to share with you. The other part I was going to share with you was, bear with me for a second. Right. These are the certain areas where you are assessed. These are not official, but this is our understanding of how an examiner will be assessing you. Now, knowledge base does have value in the exam, but it's one of the 6 areas that we'd say that matter. Just having good knowledge is not enough. If you're able to deliver that knowledge in the time given to you, so deliver it with as little words as possible. Do not give very, very lengthy answers, and have a structure in place. There is always an emphasis on having a right structure for the right scenario, for the right answer. Different structure for a clinical question, as in a general anesthetic question, a different structure for a regional question, a different structure for a basic science question, a physiology question, for example. So we'll make you aware of how to articulate your answer in a structured manner, where you use minimum words and you're able to disseminate as much information as you can. Problem solving or critical thinking. You will be given scenarios, critical incidences, or a scenario where the examiner is going to check, are you able to, exercise your critical thinking and come to a conclusion. I was trained in India. I mean, I'm trained as in I did my initial anesthesia exam in India, and the exams were quite different there. We were just expected to give information that we had collected from the book. But we weren't probed. It wasn't just about, they were not giving us scenarios where we were quizzed left, right, and center to give a balanced argument. Here, they would expect you are allowed to disagree with the examiner, but you have to give a balanced argument based on critical thinking. So that is something that is very, very important. Safety and awareness of your limitations. So even though you are an anesthetist for 20-25 years, in this exam, you are expected to be a novice anesthetist, just qualified. And European Society of Anesthesia is basically giving their recommendation that this person is a safe and sound anesthetist, and we endorse him. For that reason, you have to pretend that you will ask for help, you will call for help, because in certain cultures, asking for help is a sign of weakness. If you ask for help, then you're not good enough. You couldn't solve it on your own. But that's not the case in a Western country. Even if it's the head of the department, you will have someone come in to help him if he lands into a critical scenario, if he lands into a difficult airway or a massive obstetric hemorrhage, he will call for help. So that is very important, to have safety, perception of safety and awareness of your limitations. So that's one of the most common reasons why candidates fail. They may have answered the questions very well, structured response, knowledge display, problem solving, all that, but they forgot to pull the buzzer, as they call it. They pull the buzzer, emergency buzzer, so other people can come and help you. Pull the buzzer when it's in the exam, at the first opportunity. Communication, of course, communication is very important. They mark you verbal as well as non-verbal communication. And as I said, using diagrams is one of the parts of the communication. But how you interact with the examiner. In an exam, if you're just giving the exam sitting like that, that's not the right way to do it. Or if you're in the exam just leaning too forward and just using your hand and just making those, that's not appropriate either. So having a balanced interaction with the examiner, where you're actually, it feels like you're talking to a good friend, and having a convivial communication, a conversation with a person, that kind of a thing, where you smile a little bit, you're not sounding very serious, and it's that kind of attitude has to be built up. That kind of perception you have to give to the examiner. So that's just one of the things I just thought I'd share with you. Right. So let's open up the floor a bit and see who do we have. Any questions so far, guys? Are you able to unmute yourself? Yeah, you are able to mute yourself. Okay. Let's see who we have. We have Ahmed Zain. Welcome, Ahmed. How are you?
Hello, sir. How are you?
Yeah, very good. Good to hear you.
Me too. Nice to meet you again.
Are you feeling well 100% back again, or you're still a little bit under the weather? You were unwell, I heard, when I last spoke to you.
Yes, I recovered now, but I am on inhaled steroid, long acting.
Oh,
yeah.
Sorry to hear that. So I'm just going to introduce you to the rest of the people here. Ahmed passed his exam in October, and last week of October. He was with us probably from July or August, isn't it, Ahmed?
I bought the recorded courses at May and started, but I have some conditions that prevent me from continue studying for July and June and July, and then I come back at August. And starting MOOC Viva from last August till the exam.
And I think almost every weekend you were with us.
Yes, from last weekend at August till the last weekend before the exam, I was on regular attending MOOC Vivas.
So I wouldn't put words into your mouth. Tell us from your experience, how helpful and how was your experience of doing Vivas?
First of all, I used to, in my previous exam, I have a lot of exam in my home country. This exam was focused on only the knowledge part of preparation. So I used to read books and go to the exam and what I can remember in those exams. But the difference in EDAIC or oral based examination in Europe generally, they are. I know from academics that they are focusing on a lot of aspects rather than the information alone or the knowledge alone. So when I took my first Viva with Dr. Amelita, I didn't answer any question except 2 or 3 questions. That's what surprising for me. I realized that there is a problem with oral based examination. I know the information, but I couldn't express them rightly, and also I couldn't introduce my answer in a structured and well-organized approach, and also I didn't think about the safety and the priorities, what to say and what not to say. So after that, I realized that the MOOC Vivas are more important than regular reading and studying. So I have started to shift from recorded EDAIC lectures to observer MOOC Viva courses that continue recorded Viva examiner and candidate. That's benefit me very much. That I used to, when I listen to these recorded MOOC Vivas, to try to answer on my own. I pause the video and try to answer the question on my own, just in a few words. If I can remember or I cannot remember, then I continue the video and see the answer of the candidate. If I was right and if I was wrong, and then correct myself. And then if the examiner added or explain about new topic, I try to record or write it down. And I go through the most of videos, about 95% of recorded Vivas. And at the weekend, I have a chance to test myself. At each weekend, I have one session to test myself in basic or clinical. Actually, I need a lot. I need a lot of training in clinical Vivas. I have a lot of basic science Vivas, but about 1 or 2 clinical Viva only. I have tried to do more weekend Vivas in clinical, but I couldn't have the opportunity to do this because other candidates doesn't agree with me to go through clinical Vivas, more clinical Vivas. When I go through the exam, I was frustrated about the clinical Vivas more than the basic. But surprisingly, my marks were higher in clinical than basics. So it doesn't relate it to how the candidate see himself when answering. The examiner see the candidate in different way. I was also so negative about myself. I was so negative about thinking. I thought to pass, hardly pass or fail, actually, but the result was surprising. I got a very good marks. Yeah.
If you don't mind sharing your marks with the candidates, if you're not if you don't feel shy about it, can you please share how much did you score out of 80?
I think I scored 77 with one mark deficient in clinical and 2 marks in basic science.
So were you disappointed at not getting 80?
No,
just-
I was surprised because I thought I won't pass because of the last clinical session.
Yeah.
I was confused about my answer. I wasn't sure about my answers actually, but there was the right there were the right answers, and I was thinking very negative after the exam.
Great. When you sat the exam, how different did you feel from what you did on the weekend mock vivas? Were the examiners very intimidating, or were they very similar to us, or were they nicer than us? What was your perception?
Actually, my perception and the mock vivas are higher level than exam level. So I was expecting a detailed or difficult information asked in the exam, but when I go through the exam, I feel that mock vivas level are higher than are a bit higher than the exam. So if the candidate continue to take mock vivas and he gradually improve through them, I think he will take the exam, the EDAIC exam, easily, because the level of vivas questions are higher than the exam questions.
What is your recommendation for people who are sitting in 2024?
Well, my recommendation is to start practicing vivas yearly, at least 2 months. It depends on each candidate level, but I think at least 8 vivas or more. They take 8 vivas in basic science or clinical science and gradually improve through them. And between the weekends, they try to listen to recorded observer vivas and see how the questions and the exam like through the days of the week, and the weekends they test themselves by mock vivas. And they know about ordinary reading and the book sources. Everyone knows about the books and the reading, and the knowledge is everywhere. But the most important thing about the exam is to apply the knowledge, and you can reproduce your knowledge in a structured way and in a safe way. The safety is very important in the exam. If you tell the right thing and you are not safe, you will not going to pass, I think, because they focus on the safety. I have a question in the exam about obesity, a morbidly obese patient. What is the first option to intubate this patient? I think it was a weak fiber optic technique. And they ask about if you have to use a sedative in this patient while you introducing the tube, what will you use? Firstly, I thought about opioid, preferring alfentanil over fentanyl, because the alfentanil have low volume of distribution, but the safety lamp is lighted in my head, and remembered that the opioid or any kind of sedative that can cause complete airway obstruction and the loss of patient airway like opioids and benzodiazepine should be avoided. And then I tell the examiner I will, because of this risk, I will use like clonidine or dexmedetomidine that can give me a good sedation without affecting patient airways or respiratory activity. So the examiner was satisfied about this answer, and continue asking me the next question. The examiner also, if you didn't hit the answer from the first time, he will give you a hint. But I think he will give you a hint for one time. If you didn't get this help, he will go to the next question. He will help you for one time. Like asking question, are you sure about that? Do you know anything? Do you know anything else? So if the examiner asks this question, you just think about you have said if it's right, if you need another thing other than your previous answer.
Yeah. Are you sure is a very typical thing. Are you sure means that I'm not sure if you're sure. Basically, the examiner is giving you a escape route to reframe your response. Fantastic. Well, thank you very much, Ahmed, for the kind introduction today, and wish you all the best. And what I was thinking of doing while we're in this meeting is giving you guys a little bit of an insight into your career career graph. What a lot of people know about EDAIC, but they do not know endpoint that you start with EDAIC, but where does it take you? So that's very important to know. What is the purpose? What is the trajectory of your journey? So, what I will do. Shall I just do a quick sort of insight into this into the journey about into your career journey? Just give me a second, and I will. Can you guys see me? Yeah. Okay. I'll just put a paper here so I can easily draw and explain to you what I mean by this career journey. Now, imagine you're starting your journey here. You have first of all, you want to get GMC registration. That's your first point, right? I wonder if you guys can see me, if I need to get a bigger marker. Feel free to point out if you're not able to hear me properly. Can you guys see what I've written here?
Yes.
Yeah, okay, that's good. Thank you. Okay, so the first point is to get to GMC registration. The second point of your journey is to, once you're in NHS, to become a consultant, isn't it? That's what that's the end point of your or the highest point of your achievement once you're in UK. So to start with GMC registration, there are lots of methods. Some people use MTI, Medical Training Initiative. It gets you a GMC registration and you're able to cross this level. Some people use PLAB, one of the methods. Some people use EDAIC. That is the use of that is what this exam is for. You get a GMC registration and get a job. Some people use primary FRCA. Right? All these things will get you into a GMC registration and you start to work in UK. So that's UK. You've started working in UK. While you're working in UK, you want to climb further in your career trajectory and you want to become a consultant. This is the level where you become a consultant. To become a consultant, you need to have either of one of the two things. One is CESR, also called as CSER. They're going to change its name soon. And the other is CCT, which is Certificate of Completion of Training, or Certificate of Completion of Specialist Training, whatever name. But you need to achieve one of these things to become a consultant. How do you climb from this level to that level, right? So to get from this point to that point, you need to have a few things. One of the things is another exam. You can certainly with EDAIC as well, you can go there, but it's not easy. So what is recommended is you either have FRCA, final FRCA, that is continue and join a training post and get to the final point and get CCT. The other option is you take Fellowship of College of Anaesthetists or Anesthesiologists of Ireland, FCAI, and you apply for CSER. Now, unlike the exams in India or in most of the Middle Eastern countries, where if you're into an MD program, you get an MD at the end, and you basically you work as a consultant or a lecturer or whatever, associate professor, assistant professor, or whatever terminology it is. In UK, it's not like that. If you have done your FRCA, you do not automatically become a consultant. This is just a test of knowledge. The FCAI or FRCA is a test of knowledge. But in order to achieve CSER, you need to have a lot many more things. These are parallel things that you're expected to do to get CSER and CCT. There is a whole booklet. There's a whole booklet that will explain to you what are those things that are needed. You have to demonstrate doing certain modules, which are airway module, cardiovascular, cardiothoracic, pediatric, obstetrics. Those are all different modules. You have to get paperwork signed and all that stuff. So that is all the paperwork, extra paperwork that you have to do to climb to that level. If you're in training, that you get it done as you go along, and you get CCT at the end. So what I'm trying to clarify here is just by having FRCA or FCI, you do not become a consultant. You need to have some additional paperwork. But these are the 2 points where you need to be aiming. If you have done your GMC and you've come into UK, you do not want to become a consultant. You just want to continue in whatever role you are, a trust grade doctor or a specialty doctor. That's absolutely fine. Some people do not have circumstances which permit them. Some people are joined NHS at a very late stage in their life, like in their late 50s or early 60s. They don't want to pressurize themselves. That's fine. You will have a job of a specialty doctor or associate specialist, different names for it. These are called middle grade doctors. Junior grade is SHO, senior house officer. Middle grades are specialty doctors, associates, and senior grade is consultants. So that's how the system is structured. I hope I have given you some idea about your career trajectory. Okay. So I'll go back to okay. Right. Back to where we were. Any questions so far, guys? Feel free to unmute yourself. It's a very open sort of forum. Just feel free if you have any questions, and this is the time to clarify your questions. Okay, I will now. Great. I will now ask one of our other candidates who passed very recently. Dr. Jyoti, if you don't mind, Dr. Jyoti, would you be able to tell us a little bit about your experience of the exam?
Hello, sir. How are you, sir?
Yeah, very good. Thank you, Jyoti. How are you? Congratulations
Fine,
once
sir.
again.
Thank you, sir. Thank you.
Can we see you again after you have passed your exam?
Yes, ma'am. 1 second.
No, it's not a compulsion. It is at your comfort. Okay.
No, I just I want to plug in my earphones.
Yeah. Yeah, now we see your smiling face. We used to see your nervous face earlier.
Actually, I kept my kid with mom's place, so I am bit relieved.
Yeah, congratulations once again. How are you? How is the experience after clearing the exam?
It's like routine for me, sir, but it's a dream for me. I was following this academic since it was there, 2020, since Amrita Madam was writing that exam, but it took long for me to clear.
No, well done. It's not an easy exam, and it does it is once you achieved it, you realize that
I couldn't get the slots, sir, actually. So it took late for me to give. I gave in part 1 in last year and part 2 now.
I see. So tell us about your exam experience, Jyoti. How was the actual day of the exam?
Actually, the standard of questions were comparatively less than the academic standards, sir, but viva practice was very helpful for me. So I was starting this practice 2 months before, so that was helpful for me because even though we know the topic, like we need to practice it before. Then only, like simple pulse oximetry, it looks very simple, but unless we open up and we start speaking, we won't be able to say like what questions they expect and how we need to answer.
Sure.
And one more thing, they asked me this IMA Plunkett is must. I would suggest for everyone to like IMA Plunkett through and through everything they should know, those graphs and diagrams. Uptake and distribution of inhalational agents was asked for me, and they asked on x-axis. I said it is time, so they asked me the time scale also, whether it is like minutes, seconds, hours. So like that, so we should know. Unless we practice, we won't concentrate like that.
Sure. And what was the biggest sort of advantage you got from doing mock vivas? What did you think you gained other than knowledge, and what was the second most important thing that helped you?
Practice, sir. Actually, we can face the like directly, depends upon the like freshers. If they are freshers, if they have passed MD easily, they are used to that. But it's been 4 years for us, like other people also, the pattern of questions asked are different. So it's like viva practice is must. I would suggest for everyone to go for, because we will know the set of questions here. Though the standards asked were very high, but we will get acquainted to what type of questions were asked.
Was the examiner trying to probe you? Were they trying to sort of make it a lot the questions a little bit more tricky, or were they just straightforward? Just
Actually, what I observed is, sir, the way we answer, they will take it, sir. So they will start it with simple. They will judge you. They won't have any facial expressions, but they will judge you. Depending upon the way you answer, they'll take you to the level they want, unless like time is off.
I see.
For me, though, it is like that only, sir. They took me like with the uptake inhalational agents, ketamine, and she took me up to ECMO, CPB difference they asked, and what else in that also, what is the difference in CPB and ECMO, in all levels, like OT, ICU, not only that thing, oxygenation, everything they were asking.
And do you think you would have read ECMO and cardiopulmonary bypass and all these things as a routine preparation?
No.
No.
Even though we read, we won't remember, sir, actually. Only until unless we practice or we say it sometime, we face the question. It will be like CPB and ECMO are like every time they are like tension. And the listening those words itself, we will get apprehensive and we will forget.
Sure. And how was your score in the exam? Were you pleased with your score?
I got 72, sir.
Wow.
The ECG was like I couldn't say, so examiners helped a lot. So I think that was in ICU 2DCO and all they showed focus and all. They were happy scoring systems they asked. Everything was okay, but I couldn't like suddenly it was like I was exhausted. It was 10 quarter to 10 or something like that. So it took time for me to diagnose ECG.
Yeah. It's a draining day. The whole day you're sitting in the exam, one little gap here and then back again on the next one. It must be hard.
Huh.
And passing mark is 60, so you scored 12 extra marks. So you certainly had a good safety margin there to get through.
But after that ECG, I was like, whether in clinicals will I be able to score pass marks or not? But somehow I went through.
No, well done again, Jyoti, and many congratulations to you. What's the plan forward? Are you writing the English exam and coming to UK, or you're staying in India for a little longer?
No, sir, and there is a plan of moving there, but not immediately. My husband is in Canada, so we are working on it. So meanwhile, let this GMC registration process and all happen.
If you plan to move to Canada, then write the FCI exam. It is accepted in Canada. And because you've done EDAIC, you can straight away write FCI rather than writing the membership exam first. And FCI is accepted in the Canadian Health Board.
Okay, sir.
Perfect. Well, all the best and nice seeing you. And thank you again for your insight about the exam.
Thank you, sir.
Thank you. Bye for now, Jyoti.
Okay, sir.
Okay.
I'll talk to you later, sir. Well, please let me know your free time. So I couldn't like beach pay. We couldn't talk after the exam. I just wanted to have some suggestions.
Certainly, anytime. Just send me a text. So,
okay.
And even in the weekdays, just send me a text. If I'm free, then we can have a chat.
Okay, sir. Thank you very much.
Thank you, Jyoti. Thank you. Bye-bye. So before I go any further, let me correct on my mistake. I haven't introduced you to our faculty, which is the first thing I should have done. Let me introduce you to Dr. Amrita and Dr. Dikshita. These are the two faculty, these are the two pillars that are actually running this course. And we have Dr. Anwar, who's joined us from this year.
Hi.
Oh, you're at work, Anwar?
Yeah, actually I'm on duty today.
Oh, I see. So Dr. Anwar is based in Liverpool Women's Hospital. He's the master of basic sciences.
No.
He's really given a very good overhauling to the basic sciences vivas and taken it to a new level. And Dr. Anwar also joined us as a candidate as
one of the beneficiaries of academics actually.
Yeah,
a recent benefit.
Absolutely. So are Dikshita and Amrita as well. They joined us in 2020. They passed their exam in 2020 and then wrote FCI exam together, and now they run both EDAIC as well as FCI courses. So it's a cycle basically. You basically what you benefit from, you start giving it to. So it's
giving back time.
Yeah, I'm also a beneficiary of academics, by the way. Yeah, Dr. Yasser taught me, did my viva practice. So that's how we started this. So Dr. Anwar, welcome again. I hope you
Thank you so much.
any message for the candidates.
I think whatever message Ahmed and Jyoti have given as a new candidates who have appeared for the exam in the new pattern, because we gave exam 2 years back. So the kind of questions which we were asked were textbook questions, like, followed a pattern, set pattern over the period of 4 or 5 years, which we read back questions, and as well as what AK Medics was asking. But I have seen currently, current trend of asking, as Jyoti pointed out and Ahmed Zain pointed out, different questions like focus, going deep into ultrasound and all. From basic science of point of view, which I take usually, there is not much of difference in the exam pattern questions. It's a set of questions, standard questions which are being asked, which you can easily read and recall. That's it.
Sure.
Yeah. But basic sciences need more practice of speaking rather than, clinical viva. Definitely Dr. Amrita and Dr. Dikshita are doing a great job in asking them varied questions, and people can recall from their own clinical experiences. And we tend to read the guidelines and articles regarding the clinical vivas easily. But basic sciences, I think what I can suggest you all is to consider your theater environment as your examination hall. Whatever you are doing in the theater, like for example, if you are putting a patient on monitors, like you have seen pulse oximetry. I don't know whether Dr. Danish has said you all these things, but your theater is your examination hall. Try to analyze, okay, I have put patient on pulse oximetry. So what questions can I get on pulse oximetry? What is the physiology behind or physics behind pulse oximetry? BP, blood pressure machine, NIBP, IABP, invasive arterial blood pressure monitoring, or if you're inserting central line, what questions can be asked regarding central line and the graphs regarding the central line, as well as the pulmonary capillary wedge pressure, pulmonary artery catheter, this thing. Cardiac output monitoring, if you're putting, then what is the physics behind those things? Wheatstone bridge, you have to just go back. I think as anesthesiologists, we have a little bit time to on our mobiles and go through the Google and check what all things are there for that. Likewise, putting patient on breathing circuits, HME filters is there in front of you. So those are your revision points actually. Even clinical points, if I may take the liberty from Dr. Amrita and Dr. Dikshita to tell that on behalf of Dr. Amrita and Dikshita, that if you are anesthetizing a patient who is hypertensive, so what all points can be coming from the pharmacology point, or what are the medication used for hypotensive anesthesia, hypertension, treatment of hypertension. Emergency medicine also is there in front of you. Like, for example, a patient is having a hypertensive emergency, what you can do. Patient with asthma, bronchospasm, what you can do. So your theater is your examiner hall. That's think like that. I think many of us, especially back in India, are freelancers or part-timers who can't take the liberty of taking examination leave. So for you, just revision can be done in the theater. That's all I can say.
No, perfect. Thank you so much. You're very right. Make use of every opportunity you get. If you're looking at a pulse ox, go through the physics behind it, go through different clinical applications and all. There's a lot to learn in a day while you're working. So make the most of it. Thank you so much, Dr. Anwar.
Yeah, thank you so much.
Thank you. I'll just go back to before I ask the rest of the faculty to come forward. I'll just make sure that I have taken more feedback from the people who were associated with us as candidates to give their experience of the exam and general preparation. So I would request Dr. Tejal, if you're happy to unmute yourself. If you can put your video on, that'll be even better, but it doesn't matter. If you can just give a audio response, that's fine as well.
I'm actually at a friend's place right now. So yeah,
Yeah. How are you? Congratulations once again.
thank you so much.
We saw you in more stressful times, so it's good to see you
Yeah,
smiling and
yeah. Thank you so much.
most.
So I would actually like to add more to whatever Dr. Anwar had just said. So I work at a medical college, in a medical college as a senior resident, and it's a very high intake and outflow place. So I did not get too many leaves. I had a lot of things going on personally and professionally. And I had started my preparation like seriously, like 1.5 months before. And so during this time, like I would just try to teach my juniors as much as possible. As many PGs I would get in OT, I would just keep talking to them, especially basic sciences. I feel basic sciences, the way they question in India versus how they question in like the international standards, very different. In India, it's pretty straightforward. Like they know, like you will get to know what they're asking, like directly. But in an international forum, I feel it's a more open question, and then they will guide you to whatever whatever they are asking. Uh, with regards to India, I think most of us over here are from India, I'm assuming, and the workplace, especially if you're working for like a very high inflow outflow hospital, it gets really difficult to study. I had taken around 10 days off from my work, and I had just dedicated to like studying in and out, how much ever possible, how much ever was possible. But I didn't do that well in the exam, but I did pass, and I'm just glad about that, to be honest.
Yeah, passing is
Yeah.
passing is the most important bit. I think the next stop
Yeah.
is getting 100% marks, which Dr. Dikshita did. So, but anything in between is
I would,
absolutely
I would,
fine.
I would really want to highlight this one thing with Dr. Amrita. I remember I had a viva with her. I think roughly a month before my exam, and I had gone into the viva thinking that it would be a basic sciences viva. I was not aware that certain vivas are taken by certain faculty, and I whatever I would read in OT, like I would try to like answer. But the one topic that I had not brushed up on, which was one lung ventilation, and she caught me, and she really like she knew that I did not read, and she pointed it out very correctly. She's like, I don't think you picked up this topic. And I was like, yeah, that is so true. I agree. I totally agree, ma'am. I have not read this. And yeah, I'm glad. It was like, I feel it, that was like a eye opener for me, like, and that I really need to get my priorities sorted. And I sat and I read after that. So I
Did
would
the
really like to thank you all.
most welcome. Did the vivas build up your confidence in the exam? Did you feel that you were able to face them with much more confidence?
Yes, I would say that. And more than that, it really made me think that for me, at least from my perspective, it was more of like your priorities and how to manage your time better. Like I didn't get the, like, I feel like my time management, like 1.5 months before an exam, I feel is too less. You need to start preparing much, much more in advance. At least 3 or 4 months, you have to keep reading, you have to keep revising. But like I had, my circumstances were a little different, and I just locked down the last 1.5 months, 1 month, I would say roughly. Like I really did my best during that 1 month. So yeah.
Well done, well done. I mean, 1.5 months is a very good achievement in 1.5 months. It's not easy to pass this exam. So
Yeah.
really pleased for your success.
Yeah,
So,
thank you so much.
any plans forward? Are you going to sit English exam and apply for jobs in UK, or was this just?
Actually, I have been, so I'm really looking forward to the next session, which is the FCAI and FRCA session. So I would like to really get into that session. So later on, not right now. Like I think I'm still reeling from the stress that I had during my exam time. But yes, in the future, I would like to pursue FCAI or FRCA. I would really like to go for that counseling session.
Sure. Did you see the graph, career graph that I just plotted
Yeah,
just now?
I did. It's just that my Wi-Fi connection just got cut off in the middle. I wanted to ask you one thing. Like, once we move to UK, is it like we have to sit for FRCA again, part 1 again? Because I heard a few people saying that it does not matter if you do EDAIC 2, you have to write FRCA part 1 again, then do the training, and then take FRCA part 2, and then that's how you become a consultant. Is that true, or is that?
It's partly true. There are two ways of training. There are two verticals. One is going through the training route. If you're taking the training route, then you have to sit the primary FRC again. Even if you have, even if you have done FCI, it doesn't matter. You have to do primary FRCA, apply for a training post, and do the next 4 years of training. That is, you start at ST3, third year of specialty training, and go all the way to ST7. So 3, 4, 5, 6, 7, actually 5 years of training. And if you do not wish to take training pathway, there is a parallel pathway called the equivalence pathway. It's an equivalent route. It's called CESAR at the moment, CESR. There, if you have your FCAI, that's enough because in the CESAR pathway, there are different criteria you need to satisfy. One of the criteria is test of knowledge. As a test of knowledge, FCAI, EDAIC, FRCA, they're all equivalent.
Right.
So if you have done that, that's fulfilled your test of knowledge criteria. Then you need to do other criteria, which I mentioned, that you need to complete all the modules. There are about 8, 9 modules that
The
you need to
requirements.
complete. Yeah.
Yes.
Then you need to have a bit of quality, quality improvement, QI projects. You have to have some audits. All those things are important. Communications, courses, all these things are part of which it takes about 2 years at the very least to compile all that paperwork and then submit it. Then you get what is called as specialist registration and the GMC. This is a basic registration, but what you get after EDAIC. Once you have done either your training or your CESAR, then you get a specialist registration. You are allowed to work as a consultant. And
Yeah, you see.
Yeah, that's it.
I actually just wanted to ask one more thing to Dr. Amrita and Dr. Dikshita. The FCAI, does it open Europe to you?
No,
Like,
FCAI
provided you
Irish fellowship and it's Ireland, though again whatever sir told, it is the only difference between FCI and FRCA is for FCI you can clear sitting at India like we did. Okay, so if you have enough time, like you're planning to shift to UK in say some 6 to 8 months, you have some time, it's better you finish it off FCI in the meantime.
Yeah.
Because it happens 2 to 3 months, like the exams happens, like we did within 6 months, we cleared both parts. For FRC, you need to have 12 months of training as a registrar, also not training exactly the word is 12 months of job you need to do in UK to be eligible for secondary FRC.
Yes, no, that is okay, ma'am. But I wanted to ask you, like, other countries in Europe, like, does FCAI?
It does. I'll tell you, EDAIC is enough actually. EDAIC is enough to practice in other countries in Europe, but EDAIC is not a fellowship.
That's what. Yes.
If you have FCI, that's another European fellowship, which is equivalent to FRCA as well. And your prospects of getting better placed in Europe will improve.
No, I have made up my mind that I do want to do a fellowship. Like, I want to back up my diploma with a fellowship. And as it has been said on the different websites that 7 years after that, your EDAIC like title is not applicable. So yes, I do want to back up my fellowship with my diploma with a fellowship. The question I was asking was like, for example, I'll be direct about a country like, let's say, France or let's say Germany. If I want to go there as an anesthesiologist with an FCAI degree, like, will they accept it? Like, other than the fact that I do have a language, I have the language covered as well. Will they accept it as an anesthesiologist position? That is my question.
They would accept. I mean, first of all, I'll clarify that I have very limited knowledge of their system, but I do have colleagues who are French and have moved to UK to practice. They do have their own exams as well. Other than EDAIC, they have their own exams. And if your long-term plan is to stay in France or Germany, I would recommend that you do specific fellowships that are from that country. You know, they do entertain EDAIC, but there are certain specific fellowships for the particular country. I would say that it will definitely give you a better edge in your career prospects. But if you're not very sure that you're going to be living in Germany exclusively and you could move around in other countries, then FCI is certainly more handy because English is the medium of instruction there. In French exams and German exams, you will most likely be
in the language.
their language, and it's a big disadvantage. So
Yes.
you're working yourself against a lot of odds. Whereas if you do FCI, at least you've sorted the communication part out.
Yes, I agree.
And it is a very well accepted, widely accepted exam, even in Canada. Other than USA, it is accepted in Canada, in all the European countries, not in Australia. Yeah, Australia, they wouldn't give you the consultant job. You have to still go through the FANSA exam, but you do get some credit points because of having done the fellowship in Australia and New Zealand. I was saying, but to answer your question, I would, if I was in your shoes, I would do FCI. Improve my chances of being placed better in Germany or France, and then look at doing their own fellowships, the local fellowships, if that is what helped me in my career progression.
Okay, thank you. Thank you.
Most welcome. Great. All the best again, and let's check with our other candidates. Any questions, guys? You are just listening to all this conversation. I feel that you should be asking more questions than what we are providing you with. Any questions? Doesn't matter if you have a basic question like, should I be using a pencil or a pen? Ask it. Don't leave it to a chance. You have people here who have first-hand experience, and it will really be better to get clarification. No question is silly or menial. It's all questions are equally important. So feel free to ask questions. Now I'll ask. In the meantime, I'll ask one of our other candidate who passed very well, Dr. Nafis. And I'll please, Dr. Nafis, would you be able to unmute yourself? Yeah, great. Could you please share with us your experience, Dr. Nafis, and once again, congratulations on passing the exam. How are you?
Good.
Yeah, good to see you again in a non-exam format. What are your words of wisdom for the people who are sitting the exam?
I think apart from reading and frequent revision, you need to be conversant with the pattern of exam. If it's an MCQ exam, then you need to practice more MCQs. If it's a viva exam, you take more vivas. And the vivas at academics, they really help you. Because at the end of it, it will be the viva pattern in which we will be examined. And we have to give very precise answers in a very short time frame. So the answers have to be structured, very precise, bullet points, and so that we can cover most of the questions which the examiner is supposed to ask. So it is here that these vivas at academics, they are really helpful, really helpful. You have a very wonderful faculty with you. People, you yourself and your faculty, they are always improvising with the changing patterns of the exam, upgrading their teaching skills, upgrading their skills as well. And I'm really indebted to all of you, because these vivas really help me a lot to prepare and focus myself.
That's great. Thank you so much, Dr. Nafis. How was your experience on the exam day? What were the examiners like? Were they helpful? Were they intimidating?
Yeah, no, the examiners were very helpful. They were giving us leads, hitting us, and they were helping us to reach to that answer. If you're going wayward, they would interrupt and they'll try to bring us back to lead us to the answer they want to hear. And they were very helpful examiners. And I don't think there's an issue of language as such with the examiners. At least the 8 examiners which I faced, 5 males and 3 females, they were very helpful, very friendly, and they were not at all intimidating, not at all intimidating. And basically, I think that the confidence I got from drivers and from mock drivers, they really helped me in on that particular day of examination. It's a long and a tiring day, so these vivas, they really helped me, your course material.
And I can see a little wire in the background, your preparation for the exam. You had set up an extra modem for the backup.
Yeah, I got an extra Wi-Fi, an extra router for the exam, basically. And with the access of this was only confined to me, so that I can have an uninterrupted internet the day of the exam. And I was fortunate enough that everything paid off, that everything was falling into place as my exam progressed.
Yeah. So that's a very important point, actually. You know, people have failed the exam, not failed, but their exam could not be completed because of interrupted internet connectivity. And it's so important to have a backup of some sort of internet connectivity, so that you don't, land up into trouble. So really important.
And I was lucky enough, there wasn't even a single glitch with the exam. The whole, I think, 8 to 10 hours of whatever started at around 10:30, 6 or 7 in the evening, and there wasn't even a single glitch with the internet connection. So I would basically count myself lucky. Despite the fact that I really worked hard, I took around 25 days off, get up in the morning and study till night, waited for the night so that I could keep my books away and get some rest.
And what are the areas that you found that you really needed to work more? I mean, you've done your post-graduation at least 10-15 years ago, isn't it?
Yeah, 15 years back.
15 years ago. So which areas did you find that you had to work extra hard?
See, with this, I think the changing pattern of the exam, there's focus and ultrasound guided blocks and ROTEM and these X-rays, ECGs and USG, basically the diagnostic and the imaging modalities. These are the things we really need to concentrate, because they count a lot. The rest of the things we are doing in lab, it's our day-to-day practice of anesthesia. They also need to be brushed up, but these are the things, and I'm really greatly indebted to Dr. Amrita, the class which she took on focus, that USD thing, that echo. I was asked an echo and I was shown a picture and it had embolus. So that really helped me a lot. That really helped me a lot.
Thank you so much. Thank you so much, Dr. Nafis.
It's a pleasure, ma'am. It was. I'll basically one of those sessions which you, in which you and Dr. Dikshita were not there. I just compared. I don't think it would be nice to say it again, but your vivas, Dr. Dikshita vivas, viva with her, Dr. Anwar's, Dr. Danish's, I think I'll be really indebted to you for the rest of my life, all four of you. So you people are doing a great work at academics, guiding us and the guiding us to some purpose.
Thank you so much, Dr. Nafis. We are in turn indebted to hear this.
Ma'am, it's a very sincere, it's a very sincere reply, because I was not into academics for the past 16 years. I think I last studied seriously for my exams in 2007 for my DNB. But being in the company of you, Dr. Amrita, Dr. Akbar, it really helped me a lot.
Dr. Nafis, can I ask you one question? So
Sure.
now you are on the other side of the boat, means on the sea. So you are one of the successful, but while you're preparing with us, so you are encountering us in vivas. So what it means, it was boosting your confidence, or you are fearful to face us? So what exactly was your mindset during that phase?
See, ma'am, there was an element of fear, but then we had to overcome that element of fear in order to succeed. Because I was especially they are a monster. But if the candidate is not taking it sportingly, he will get I think bogged down. So because like the other say, I said Dr. Amrita's viva, and I was comparing your and Dr. Dikshita's viva. So I was saying Dr. Amrita's vivas are like being vivaed by a mother-in-law, and Dr. Dikshita's viva is like being vivaed by a mother.
Oh my God.
But ma'am, if we take it sportingly, and if we end up your vivas especially, I would say, because they end up they act this is my personal view. They help me a lot, because I remember taking my first viva with you, and it was you asking my senior gravis, and I was lost. I was lost. I think I could not come up with a single answer. But then, as time progressed, and on those weekend vivas with you and Dr. Dikshita, Dr. Anwar, you taught us basically the way to go ahead, even if we are not aware with the topic, how to proceed. I was asked,
Dr.
Yeah.
Nafis, I'll just ask you a quick question. You know, when we did your vivas, there was very important aspect about safety.
Yeah.
You know?
Yeah.
So
Yeah,
while you're having this conversation, can I just ask you if your mother-in-law is around you or not?
No, she's not around. She's not around. But the thing is that with you and with Dr. Amrita, Dr. Dikshita, yeah, you basically taught us how to face a unconventional topic. Like I was asked about that, the same thing with Dr. Amazon, morbid, obese, and airway. So the first thing that came to my mind was safety, and I said I'll ask for help. I'll ask for help. I'll get a difficult airway trolley, and then I'll go for an awake intubation. So I think I would not have said those two lines that I'll ask for help, I'll go for a difficult airway trolley, if I had not attended these vivas. So basically, this is one of a big plus points, that how to face an examiner and how to face a viva when you're not aware of the topic completely, when you're not confident of the topic. Even then you can score, like that pediatric viva, how to go ahead. So instead of coming to that, even before coming to that core topic of diaphragmatic hernia or TOF, if you know about the principles of pediatrics in general, then we can score, I think, passing marks even before coming to the core topic.
Thank you.
Great.
So, ma'am, please don't take it otherwise.
I'm very happy. That is the concept of our group. We are like four different people. So one will be a mother, one will be a father, one will be a mother-in-law, maybe one will be a brother. That is the concept of our group. So you have to face the of examiner, because we all are at four different places of the world also.
Yes. So those vivas really helped me, especially your focus class. The amount of effort you took for that class, ma'am, it really helped me, and it paid off. And I was lucky to score 72 out of 80. I was 90%. I never imagined. I just wanted to pass.
Yeah, now that is undisputable, the undeniable that the effort that is put by the faculty here, especially
Yeah.
the three of them, Dr. Amrita, Dr. Dikshita, and Dr. Anwar, it's more than 100%. It's certainly, and that is what we expect from our candidates. That if we are working that hard, we want you to cross
Too
that
humble
extra
for
mile. Yeah, to that.
too humble for you to ignore yourself to exempt you from those three. In fact, your efforts are also well appreciated and will take a note of. Yeah, and all four of you, and in fact that radiology class and Dr. The new faculty you have, Chandra,
Dr. Anwar, Dr. Das Gupta. Yeah.
Dr. Gupta, yeah. So you have an excellent faculty, and best thing is that you are not content, but you're still you're trying to move on and change and adapt to the changing pattern of the exam.
Yeah, you have to have a relevance. If you're teaching old topics which are no longer asked, then the relevance is lost, and there's no point in preparing people with out of date stuff. So it's we try and keep ourselves in both the exams, FCI as well as EDAIC, to really give relevant information, which is because time is so short. You want to get processed information which you can straight away consume and perform as a result. So it's really important. But nice to have a good conversation after success. I think this is what we want from all of the people that are joining today, that at some point next year, you will be in the same situation, giving the positive input from your experience and sharing your success story. So it's that is always our ambition and our dream, that we take you to the other side and listen from you and share the success with you. And can I please ask Dr. Devika, if possible, to please unmute herself and share her story? Dr. Devika, yeah, I'll just. If I'm not mistaken,
Yeah, Dr. Devika is there, sir.
Yeah, I hope it's the same Dr. Devika who passed the exam, because
Yes, ma'am. Can you hear me?
yes, we can hear you, Devika. How are you?
Yeah, hi, sir. I'm good, sir. Just watching the World Cup in between. So,
Oh, I see. Yeah, I forgot about that for a second. Okay.
yes, I was like listening in between, so I wasn't sure if you'd call my name. Yeah.
No, I'll catch up on the score. I forgot that. But by the way, what's the score? What's happening? First, update me about the World Cup, and then we'll take the update about your.
It's kind of sad, sir. So that's why I stopped concentrating. It's not 7 for 6, and all our batsmen are out. It's the bowlers who are lined up. So yeah.
How many for 6?
207 for 6, and we are on our 41st over.
Oh, okay. Let's leave the World Cup for a moment then. Let's focus on. So, hi, how are you? Good to see you in a relaxed mode with the stuff on your shoulder, the feathers on your shoulder, under your cap. So how's the feeling after passing the exam?
It feels good, sir, but still reeling in the after effects. Like, there was a lot of stress which was built up over the last 2 weeks, and suddenly the relief is there, but then I don't know what to do next. I'm like, what exam can I now focus on next is the thought that's in my mind.
Yeah, you if you stay in touch with us, we'll take you through more exams. So there's no end to it. Yeah.
Yes, sir.
So definitely, how was your experience of the actual exam? If you just could share your version, please.
Yes, sir. So, sir, I'd been preparing from, I think, April of this year. But it was on and off because I'd given my DNB exams also. I was post-MD doing my year of senior residency. So then for MD, I had taken a few days off. Then I did some family trips and all of that. So it was on and off. But it was the last, I think, 1 month that I actually sat down properly to study. And I took a leave of 2 weeks. And that was when I started the viva with academics also. Because before that, I wasn't sure. I just thought, okay, I'll just keep reading and maybe that will help me. But then I realized towards the end that I was reading, but I wasn't confident whether I'll be able to reproduce it on the day of the exam, because there's a protocol for everything. Like, it shouldn't be like I have read enough, but I didn't know how to perform on the day of the exam. So I just registered, like Jitesh had put up in the group about those Viva combos. And I figured that I had like enough for 6 Vivas if I took one every week. And I started off with Dr. Amrita. Then I finished with Dr. Amrita also. Then there were a few Vivas with Dr. Dikshita in between. So I think what helped me there was it made me confident, and like it like the reviews they were giving me, sir, like, okay, I know enough, but these are the areas that I need to work on, which I couldn't figure out myself. Like I remember them telling me that my preparation is adequate in so many areas, but that I need to focus more on images, or I need to focus more on this, that my underconfidence there was like visible. Which I remember that one session with Dr. Amrita where focus was there, and I was nicely trying to skip past the whole thing, and she picked it up immediately. And that is something I've been doing since MBBS. If I don't know something, I just want to rush past this whole thing. So I realized that I shouldn't be showing that also on the day of the exam. I should take my own sweet time, as I do with the other topics, like not to make it that obvious. So I think I would not have been, I was very cool on the day of the exam. Like my stress till the previous day was more to do with how will I cover so many topics before the exam. It was not to do with how will I perform on the day of the exam. And once the exam started, the same day, I remember, okay, it's not very professional, but India was playing against Netherlands. And I remember like going out and watching the match in between and coming back, because I was like, I've done the best I can. And because of the Viva sessions, I just wish I had taken them, a little prior to the last minute. That was the only thing which I wasn't sure about. Like, I should have taken at least 2 months is what I felt. But I think it's mainly because of the sessions I felt like, okay, what I've read, now I can reproduce. And now what I've not read is, it's beyond my reach at this point. Yeah. So I think, sir, that it just made me cool on the day of the exam. I was not bothered as to how I do. I just wanted to like have a fun time while getting it done with.
No, I can see you, the way you're recalling the experience. It must have been a very nice and easy day in that respect.
Yes, the examiners were very nice. The only thing is they'll try to guide you, but you have to allow yourself to be guided. Like, if you're very adamant with your answers, then there's no going ahead with any of that. But I personally, it was fun for me. Those 25 minutes of Viva, I didn't bother too much about what they're going to ask me. And I got a little lucky, I feel, because I had told Dr. Amrita this after I messaged both Dr. Amrita and Dr. Dikshita after the exams. Because I did it because I was extremely thankful to them, not because of any formality or any of that. Because my long question for table 3 was myasthenia gravis, and I don't think I would have put that much of emphasis on myasthenia gravis had I not attended a session where the Viva topic was multiple sclerosis. So that was one topic which I came out and read in between the tables, that and TEG and all of that. So I kind of, so the thing is, I'm a person who will give equal emphasis to all the topics, like the questions which they put up in the group and all of that. I'll try to cover everything equally. I'm not somebody who will emphasize on the more important topics more. But I think because of these Vivas which I was attending, it gave me, like, it's impossible to cover everything equally. So it gave me that idea as to which to focus on more. And I got lucky that way, because I think in between each session, whatever I read, at least one question they've asked. And I mean, I think that's because, that guidance was there as to what to cover, what to give how much time to. Like, I'd not given much time to TEG before. But then I realized, okay, TEG is very, very important. So I just gave more time to TEG then that way.
When you finished your Viva on the day, did you feel before getting the results that you have performed well enough to pass, or were you still skeptical?
No, so I knew I would pass, but I had messed up a little at table 1, because I think my presentation wasn't ordered enough. I think I was in a hurry to because they actually asked me to slow down in table 1. I think I lost marks there in table 1 and 2. I knew I would pass, but I was sure I would not get the marks which I had. Okay, this doesn't sound good, but I knew the answers. But because of the way I presented, I know I have lost marks at 2 tables at least. And the thing is, I just realized after the exam that they're looking more for your basis, what you built it upon, and not just. I think we are used to a system here back in India where you just recollect random things and just spurt it out. They are looking to see how you have understood what you have learned. Because when they asked me to draw the nerve action potential, and I was kept on saying, okay, the resting membrane potential is minus 70 millivolts. The only thing they asked me was, how is it minus 70 millivolts? And they didn't want me to tell the Nernst equation, but they wanted me to name it, and they wanted me to explain how it's minus 70 and not some other number. I mean, it's all there in the books, but I think unless you prime yourself to understand what you're studying, it really doesn't matter there. At least for the basic sciences part.
Absolutely. No, that's great. It's always a pleasure to see candidates who've had a fantastic experience, and thank you so much. And most welcome to come and join us as a faculty if you feel to the urge to teach. Then it's always a good experience it helps in remembering the stuff that you actually learn. So
yes, sir.
We encourage all our candidates who have passed and who have the desire to take it further to come and become a faculty. And on that note, I'd just say that we will be coming to India. We'll do a face-to-face session in Delhi and Bangalore sometime in February. We're expecting. So if you're in that area, somewhere around that area, then please do feel free to come and join us. We would be wanting to have you guys as a faculty as well on the day, because we'll be running some mock vivas. We'll come prepared with the material, but it will be good if you guys live anywhere close to Delhi or Bangalore, and you guys are able to join us. That will be really good. But thank you so much again, and it was a pleasure, and all the best with your future plans, and all the best with the match. I hope India is able to make the most of these next 7-8 overs left and get them out, get the Aussies on the way back home.
Hopefully, sir. And thank you so much. Thank you to everyone.
Most welcome.
Dr.
Thank you. Take care and have a good day. So I don't want to prolong the session, guys. I just want to give you a familiarity with the of the exam. We have a few more candidates. Dr. Atul is there, Dr. Sohana is there, and Dr. Falguni was there as well. I'm not sure if she is still there.
She's left, sir.
Sorry?
I think she has left.
I think she's left, sir. Yeah.
She's left. Okay. Because what I wanted you guys to basically have was that all is not hunky-dory. We do have a high pass rate, like 70 to 80% candidates pass. But unfortunately, certain candidates don't make it. And I wanted to show you that side of the story as well, and hear directly from them that what was the learning point from the exam and how they want to overcome it in the next year. And it basically, you get to hear both sides of the story, which is very, very important. But unfortunately, she has left at the moment. I don't think there's any other candidate here, if there is, who was not successful this year. Although you may not have been with us, please feel free and share your experience. It's quite important to for the candidates to know exactly where the weaknesses are and what are the things to avoid doing to have a better outcome. So please feel free if you have anything to add. In the meantime, Dr. Dikshita and Dr. Amrita, anything from your side, please? I've been doing a lot of talking for the last 1.5 hours. Please share your motherly and mother-in-lawly experiences with us, please.
Okay, I would like to just add on a few points, because I think most of the points you and Dr. Mehta have covered it. So what I had, my personal experience with academics is that first thing is as a student and as a faculty both. First thing is when I was a student way back in 2020, I was much benefited of this course. It gave me an insight into the course as how it is giving probably to the current candidates. So it gave me how to prepare about it, how to go about the preparation, what is the time frame, everything, and the way to answer the structure, everything. And not only that, I got my probably the best study partner all throughout my career, Dr. Amrita. So we prepared together for the exam. Luckily, we were giving during the same time, and we happened to be close. Our frequencies matched, and we still remain to be the best of pals now, both in study as well as personal life. So that way, probably I'm benefited both professionally and personally. That's one thing. Then the second thing I wanted to say is that with regards to the vivas, why I would insist on taking up maximum vivas is that commit whatever mistakes we can at this stage rather than on the final day. So you learn from your mistakes, and not only do you learn from your mistakes, you learn from others' mistakes. So when you learn from others' mistakes, you're already saving 2 steps ahead. You don't have to commit that and then learn it. So you learn a lot, not only about the subject, but what to do and what not to do. So that's my in short thing I want to say for all the candidates who are going to appear, prospective candidates. And I'm sure the other candidates who have passed through this exam would also agree with me in this. That's all.
Thank you. Thank you, Dr.
From my side, what I can see in the chat box, most of the people ask us which book to follow, which book to read. But what we actually see is, there are many types of students. Few people are there who read and we understand and they're super intelligent. Few are there who understand but they cannot deliver. And few are there who have difficulty in understanding from the beginning. Okay. So if you are studying, you are gaining the knowledge, it's fine. But you always try to, it's that lag between understanding and delivering is actually huge, which you realize on the day of exam. That is actually something for that you need to take the vivas. Plus, there are so many articles, so many guidelines, so many, even me and Dr. Dikshita know how much pain we have to take to go through all the guidelines and articles and the updates so that we can give in a short time to help you out. Plus this new things, focus, ultrasound, today only we are discussing, it's being asked because it is actually clinically relevant. Apart from just exam purpose, it will improve your knowledge. You can work better with those things. So that is what I have to say. So this thing, it's not that because we are teaching, we are telling, but this kind of thing which is not there in the book. So it is more important to focus on the topic, on the number of topics you can study, and try to frame the question on yourself. Okay, this can be asked. Okay, from there they can jump to here. And you try to answer yourself when you are preparing.
That's true. That's true. I think
can we take some questions from them? That would be
yeah,
great.
please feel free to unmute yourself and ask questions, any form of questions. And if you don't ask us questions, then we'll start asking you questions, and that wouldn't be a nice scenario. I'm just
Hey,
joking.
doctor. Hi.
Yes, Dr. Aditya. Hi. How are you?
I'm good. I'm actually Danya. So I just wanted to ask you, what would you suggest online or face to face, like for the
Booking the exam.
part two?
The advantages and disadvantages to both. Online is way straightforward because you are giving the exam in the comfort of your home, your own space, your own cup of tea, no traveling, no booking of accommodation, none of those stresses. You just wake up in the morning, preparing yourself, and that's it. You're just there, ready to give the exam. However, the slight problem in the online format is that if you have a dodgy internet connection, all those things can be a bit intimidating. It can upset you, but it's more cost effective. It's more time consuming, time saving, and it's a lot more convenient. Face to face, if you're a person who likes to travel, see new cities, have a little bit of an experience, Usually all that stuff is very enjoyable when you're going for courses, but when you're going for exam, you're so stressed out that you don't want any extra hassle. So if I was in your shoes, I would have reconciled myself with an online exam. That's why the online seats get booked very, very quickly. So that's what I recommended. Be very, very quick in booking your seats. Be very receptive with all these WhatsApp and Telegrams groups. The seats will go within an hour or two. That's how quickly they will go. So you really, really have to be very swift. Make sure your bank cards and details are working. Have them tested with some international transaction beforehand, making sure none of that glitches and causes problems, and book the exam straight away.
Okay, thank you.
Where are you based at the moment?
I'm in Dubai, doctor.
Dubai. And what time of the year are you planning to sit the exam?
I was thinking around May. Is that too early or?
No, it's not too early at all. You can certainly. When did you last do a viva exam before the?
No, this is the first time I'm attempting. I just cleared the part 1. Part 2, I'm attempting for the first time.
And when did you do your post-graduation exams?
Oh, that was 2013.
13. So it's good, 10 years. So I'd say about 5 months is not bad. 5-6 months is not bad, but start your preparation probably by December. Don't leave it too long.
Yeah.
And hopefully we might be in Dubai to run a face-to-face course. So you might join us there then.
When is it?
February, looking at February, haven't finalized the date, but we might do it in February. In Feb, we will do a tour. We'll go to Dubai and we'll go to India. So you might want to, because face-to-face is a different experience completely. We're able to comment on a lot more things. The interaction is different. So that is something which will probably be a lot beneficial.
Thank you.
Thank you.
Hello.
Yes, Dr. Jinan, how are you? Where are you based at the moment?
I am in Abu Dhabi. Yeah, oh, sorry.
There are two J's here, Jaya and Jinan. Wondering which one is. Let's start alphabetically.
Jinan.
Okay, yes, Dr. Jinan. Can you can come first, please, Dr. Jinan.
Yeah. Good morning, good afternoon.
Good afternoon.
Yes, just I have two questions. The first, what do you mean by the FCI exam is acceptable in Canada? Do you mean that it is recognized there, or I can go and directly work there, or just I want to know?
Yeah, I can figure out exactly what you can do with the FCI in Canada. I think you can go and do fellowships. I'm not sure about their specialty registration. I will, in the course of this conversation, I mean, by the time we finish the next conversation, I will Google it and figure it out for you. And I'll let you know. But I do know of colleagues who have gone to Canada with FCI certification, and they're practicing anesthesia there.
Okay. Okay, the second question is, how many times we can sit for the EDAIC Part 2 exam?
As many times as you want.
And because I've done the Part 1 maybe 3 or 4 years ago. So is it matter how many years apart?
No, I don't think it matters. The validity is so far. The validity is not time restricted, time limited. So you can sit and you can sit it as many attempts it takes you to pass the exam.
Okay, thank you.
But certainly from our experience, first 2 attempts are the best attempts. Unfortunately, I know a candidate who has sat the exam for 5 attempts, still hasn't passed. So the chances of passing the exam after the first 2 attempts diminish remarkably. So make the first attempt as the best attempt, and I'm sure it will be, but I'm just giving you my experience of this exam, that it's always important to attempt the first attempt as the best attempt.
So why? What's the cause? After 2 attempts, you said that the chances is less.
No, there's no partiality or any differentiation from the European Society of Anesthesiologists. There's I think the personal effort starts dwindling down, or you start going through the same resources, and somehow the performance, after in the first 2 attempts, the performance peaks up, but after that, the performance plateaus and actually starts coming down. So the particular candidate I'm talking about, he's been failing by 2 or 3 marks every time. And it's not gone like catastrophically down, but it's that margin of 2-3 marks he has never been able to overcome.
Okay, thank you very much.
Most welcome. Dr. Jaya, please feel free to ask your question.
Hello, sir. I'm Dr. Jaya.
Hi.
Sir, actually, I don't know if I should ask this. I was thinking EDAIC is the last thing, and now I came to know that we have to clear FCAI and FRCA. And sir, my plan is not to go and settle anywhere. I just wanted to give this exam and find an opportunity to go work there and come back. So, I was thinking like EDAIC, like I'm working here, I'll be getting retired in March, and I thought by that time I should finish this part exam, and thereafter I can get an opportunity to go work somewhere, work for a few months, come back. It's like just going for a holiday, working somewhere, coming back. No settlement outside.
Okay.
So how does it work? Can it work only with EDAIC, or I have to give other exams as well? Like
No.
you said for fellowship and all, because I'm planning for fellowship here only in India. Like
So,
pain and regional anesthesia or pediatric anesthesia, whatever. So
it's very important that your career objectives are very clear. If you're planning to pursue your career aspirations in India itself, it's a very competitive field in itself. If you want to be in the competitive area of anesthesia, anesthesia practice, then I would recommend that it's good to have foreign, fellowships and exams. But if you're in corporate world or those kind of areas, then you will need to have local presence and local exams. And I mean, Dr. Amrita is the best example of that. She has a fellowship of College of Ireland, yet she and EDRA and EDAIC, yet.
Pediatric and neonatal anesthesia also. And so that
Yes,
is why I'm happy she told both the things which I do.
Yeah. So, and yet she is a very, very high performing anesthetist in India. She works in Varanasi, and she is a visiting faculty of regional courses, of airway courses, lots of different courses. So she's able to balance both those things. So it's very important how you draw your career path, and based on that you take decisions. I mean, she's never come to UK or Europe to work, but she's done all the exams that were recognized, that are based here. So if you just want to come and visit UK as a practice, just to practice, see the practice of anesthesia here, EDAIC is more than enough. You don't need to do FCI. Yet, if you want to take it as a personal achievement, then I would certainly recommend do a fellowship. It does matter as a post-nominal thing that it does get highlighted when you write FCI or FRC after your name. So it's certainly an achievement. But if you're just looking at as a one degree from another country, then EDAIC is more than enough.
By the way, where are you working here in India?
I'm in Air Force. I'm a short service commission officer and getting retired in March.
Where are you posted right now?
I'm in Coimbatore, Sulur.
Coimbatore. Okay.
Yes, ma'am.
We have quite a few people from Air Force actually who are sitting the exam. Yeah, there are quite a few of them, and finish their short service commission and they want to move abroad actually. So it's you won't be the first one.
Actually, my family settled here. My husband is MD medicine here in Kerala. I was only looking for job opportunities that too for a short period of time, like 6 months in a year, or just like I have known in Netherlands. So I was thinking that if I pass this exam, I could get a job opportunity there. I can work there and come back. So that was my objective. I can't leave the family and just a job opportunity, not like career progression. I was not looking out for that. So
I
that
mean,
was my objective.
don't forget that moving for 6 months is more stressful than moving for 5 years or so. You know, the kind of adaptations you have to go through working in a new country, in a new system, it's not easy. So, you know, if you're thinking of making that journey into another system, touch and go will be very stressful. You won't be able to think of what you'll gain out of it. The first 6 months, you will just be adapting yourself to a new system, new culture, logistics, all those things, before you actually get to learn the new practices in that country. So it's not a worthwhile sort of effort. It's not worth the effort if you're thinking of 6 months or a year. If you're thinking of moving to another country, consider at least 2 years. I mean, I'm giving you a frank opinion because I've seen people who have had similar aspirations before, and it's not easy. It wasn't worth it actually.
Okay.
Sorry, if I'm
So
sounding a bit disappointing, but I thought it's better to give an honest and realistic opinion.
Yeah, I thought that I should keep the doors open. I never know.
Absolutely. If you want to keep your doors open, get the exam. It's valid for life. It's valid for 7 years. If you want to build up onto another exam like FCI, then the results for EDAIC are valid for 7 years. But once you have your EDAIC, it's with you for the rest of your life, and you have an extra qualification. And circumstances change. You know, you never know. World is changing so fast, so it's always good to have an extra qualification if you need to travel and relocate at some point.
Yeah, sure. Thank you, sir.
Thank you.
Hello. Assalamu alaikum, sir.
Walaikum assalam. How are you?
Yes, sir. Yeah, fine, alhamdulillah. Long time wanted to speak to you, and today I got the opportunity. Yeah. So actually, I cleared the EDAIC 1. I took totally 4 attempts actually. So to clear, but I was failing it with a very, very narrow margin. First attempt I failed in 0.33, 0.66 or 1 mark. So alhamdulillah, this time I cleared it with good marks. Paper A I got 71, and paper 2 I got 75, paper B. So actually, after a long span of 20 years, I'm studying. I'm basically based in Qatar. I'm from Mysore, Karnataka. And I'm working here since 20 years in the same center.
Wow.
And so my question is, from where to start, how to start, and what time shall I take the exam? Means, because right now I'm a bit fresh with the knowledge of EDAIC 1, but it's a bit different than EDAIC 2. That's the problem. So I had to. So what is your suggestion when I can sit for the exam? And
so, I mean, one aspect is that you have sat the EDAIC 1 4 times, so you have done good revision in these attempts. So the knowledge is there. It's not very old knowledge. It's you've actually been able to revise. Yet viva is very different, and I would recommend giving yourself 6 months to be on the safer side. Give yourself 6 months. Try and sit the exam not before July 2024, July, August, or September, I would say. And as I highlighted in this session earlier, start with the mock, these viva observer course, which
Yeah,
is
I
a
took it
recorded
already,
Viva.
sir.
Yeah, I think that will start building up your. Unfortunately, we will do some work on that. We will start editing those. There are certain videos which are not properly edited. We'll do some work on that, and we'll start putting those videos in alphabetical on a alphabetical order, so you'll know exactly what topic you're listening to. So it'll be a lot easier if you've, for example, if you've recently done pulmonary vascular resistance, you open the video and you'll get the Viva on pulmonary vascular resistance. So that kind of way, start listening to the Viva, do your preparation retrospectively, pick up a topic from Viva, see how much you know on that topic by simultaneously answering on the paper, and then go and revise it. Whatever gap is there, go and revise it from your textbook or from the A to Z of anesthesia. But that way you will be focusing your preparation exactly as the exam preparation warrants. 2 to 3 months before, I would say in your case, give it 3 months before your exam. Start the mock vivas, the weekend mock vivas, because people who are slightly senior in their practice, they require a lot more dusting. You need to dust off a lot of stuff because we are senior and we have got one way of presenting ourselves. So you have to break a lot of those bonds in and you have to break yourself free and start from a new perspective. And actual interactive vivas are the real eye openers. When you are actually sitting in front of the examiner and facing the questions, that is basically what builds you up for the exam. So I'm pretty sure you'll be fine. You'll be able to finish this exam in first attempt, but give yourself enough time. 6 months is, I would say, 3 months for mock vivas, but start your preparation at least 6 months in advance.
Okay, sir. But how about this ultrasound, echo, and all? It's almost we are zero in that actually.
Does not matter. It doesn't matter. If you start your vivas, mock vivas 3 months before, you will be able to get a good perspective. Learning, the world is so much restricted now in your computer. You can get everything from Google. You can get so much in YouTube. Just pick up a topic from those lectures. POCUS, for example, for gastric ultrasound. You watch 4 or 5 videos. You will feel like you can do it on your own. I learned some blocks. I shouldn't be saying this on a show, but I learned some of the blocks from YouTube, and there was no one to teach me. So I practiced it on the straight away on the patient without having to go on a course, because the surgeon had requested that he wants that block in every definitely for that particular case, and there was no one in the department to do that block. So YouTube is a great resource to learn. 6 months is enough time. It will highlight your weaknesses. Then you can focus on your weaknesses. It's very important to recognize your weaknesses early and then start working on them. Even for candidates who have failed, unfortunately, that is the most important thing I highlight to them. Try and recognize what were the weaknesses. If you think that I did nothing wrong, then there's something seriously wrong about you. If you're not aware of your weakness, then God help you. One should be very, very well aware of where did they go wrong in order to succeed. So I think that will really help you. If you give 6 months, 3 months for mock vivas, it will really take you to the next level.
Okay, sir. But what are your plans to coming to Dubai? I'll try to fly from here.
Yeah, February we will be planning to. We'll very soon we'll finalize the date and venue.
Okay. Most probably in which week, sir? In which week of February? Like 2nd, 3rd?
Not sure, to be honest.
Just a rough,
Dr. Dikshita and Dr. Amrita's holidays. I mean, who can take leave at the time? That is very important. So based on that, we'll be able to give you a time.
So I'll try my best, sir, inshallah. I can, because it's it's just a short distance for me. I can.
Yes.
I will,
Yeah.
inshallah.
Yeah, makes a big difference if you meet face to face and do the vivas.
Yeah.
Huge difference.
Okay, sir. Thank you so much. Inshallah,
Thank you.
see you soon in Dubai.
Thank you, Dr.
Thank you. Okay, thank you.
Right, sir. Great. I think we are losing candidates now, losing viewers now. I think it's time for people to concentrate on the cricket match and enjoy the rest of their Sunday. So, any questions before we wind up the session? Anything that's not been answered, which you wanted to ask here? And congratulations, Dr. Atul, and Dr. Sohana was here as well. I think, sorry, didn't get a chance to come to you guys, but congratulations once again for passing the exam. Any final words, Dr. Amrita and Dr. Dikshita?
So just if you hear from your friends that EDAIC is very easy, that is a myth. If you hear from your friends that EDAIC is something you cannot clear, that is also a myth. Everything depends on your preparation. What Dr. I think Devika told on your how good you are built up your concepts. That is most important. Then how much you have read and you are able to deliver, and your luck on that day. So luck you cannot moderate on yourself. 3 things are there which you actually can work on. So don't get scared, because when we say we have to read so many books, most of you are like, oh, then. But it is never that so many books you have to remember. It is one topic which is given in 3 books. So it is basically the concepts and the facts which you have to focus and you have to understand and remember. So you should not have a fear before of writing itself, because I know few of my seniors and friends, those who fill the form, but when it comes to preparation, even one of the good faculties from AIMS also, I know few people who contacted me for the same. Few days before, like few months before the exam, when they hear, oh, so much of things is there to study. See what I cannot complete in 3 months is even a bigger time. I cannot finish in 3 years also. And they give up. Then they think like, okay, next year I will take the try. But if you keep on thinking, that will never have an end. So it is better you fixed your target first. I have to appear this exam in 2024. I wish to give in this first 6 months of the exam. Then you start working in that angle. No matter what is your ground level, what is your upper level, ultimately, if you stay focused on your target and goals, you will be able to achieve easily. But when you are studying, don't try to mug of things, try to understand the concepts. So that will help you to minimize on the revision time also when you read the same for the second time. And that will make your memory last for a very long time. The things will be encrypted in your mind for a pretty long time. So this is all. And just reading, getting the number of the names of the books and just jumping, it is not that exam. Like you probably heard all the things that are past, those who have succeeded the tour. They are all focusing on the concepts and those things which, like it's something, if you're seeing the capnography, you're drawing, but you should know why it is important, why we should learn about the mechanism of capnography. So everything is a why to every question. Same when they're asking about clinical exam, there is a relevance of asking that question. So you try to analyze the thing while you are studying. So that will give you an effective way of studying also. And find a study partner. Literally, this is the common dialogue. If you come to academic, I think this is the so-called commonly quoted dialogue, Dr. Amrita and Dr. Dikshita. And literally studying together, because there were few areas which I was not good at. I used to get fear whenever it comes to cardiac cycle. That is something but that part was very good with Dr. Dikshita. So she explained me properly how to draw a cardiac cycle. And in my exam, I got the same question, cardiac cycle, and I was just remembering what she taught me. And the reverse happened with her. She was very weak at one lung ventilation and HPV. And I was very good at. So I had explained her and she got the same in her exam. So we both were equally benefited. So you should try to, this is, see, in Indian exam or in certain exam, there is a cutthroat. Means percentile, and if you do good, the other person has to, like in part 1, the other person has to, if it does good, then your chance is gone. This exam is something they want you to pass. If you only don't want to pass, then only you will fail. So this is even more easy. You find a study partner, discuss things openly, help each other, and definitely we are there to help you as a platform, but even you have to give even more effort above that. So that's all from my side. So Dr. Dikshita, if you can add something, if you wish.
I think both Dr. Danish, Dr. Amrita, and all our previous candidates have already told all the points. And even in my previous conversation, I had told what I have got the best from this team. What I'm just looking forward is, I wish to see the maximum conversion of all these candidates into the success. And we would be happy to share the success story as well. So let's look forward to meet each other and in the vivas, as well as if possible in the face-to-face session as well, to continue our learning and improve our success. That's it.
That's great. Thank you so much. I'll just quickly answer a few questions, and I'll need your help as well, Dikshita, in this. Somebody has asked whether the chances of having better prospects in Middle East after EDAIC, does it improve your salary and the chances of having a better job in Middle East?
Yeah, I mean, I would say more than salary, because earlier the chances of getting a role as an anesthetist in the Middle East was easier. But now the competition has become very high. So first and foremost, to get placed in a good place, in a good hospital, these kind of additional qualifications would definitely help you get through the recruitment part of it. And after you're recruited, because I had this additional qualifications, I have been able to be placed in one of the most reputed government setups here. In fact, it's the #1 in UAE. So in that case, and though I'm not much experienced compared to the other counterparts who have been trying for the same post, so that really helped me in that way. And not only that, this kind of vivas, this helped me during my recruitment vivas as well. So they could see the confidence. This confidence was reflected over there. So that was a big turning point for me. And after that, with regards to the further promotion part of it, yes, in the course, you intend to obviously perform well, both in your career part of it, because you're learning the latest guidelines, you're able to document it better. So this is going to definitely help through that. So as you get promoted, obviously your salary remuneration automatically comes in the way. So that is one thing. But though there are a lot of other changes, guidelines with regards to Dubai for that matter, the health authority is continuously modifying its guidelines for the upgradation of the license and all. So I think this FCAI and EDAIC will definitely help you, though not directly, but somewhere in the course of it. Because ultimately the FRCA with a CSER or a CCT has a different game altogether. But I'm sure in the years to come, this EDAIC and your FCI is going to definitely help you.
And it's a stepwise climb. I mean, if you've done EDAIC, you climb one step, you do FCI, you climb another step. If you come and work in UK for a few years and get CSER or CCT, another step. If you get passport of these countries, it's another step. So it's a stepwise climb. So don't be awed by, that's a long way to go. Start with the first step. Take the EDAIC first, climb to the next into the next step role, and gradually you'll be able to build up.
I would definitely say it really helped me during my recruitment, sir, because I myself know how many of my seniors have been trying for the same post. But luckily, I had this additional qualification, which not only helped me as an edge over the other candidates, but also because of the preparation for this exam and doing the vivas, it really helped in showing my confidence during that time.
It does. And finally, there's a question about any age limitation. So this year, we had 2 candidates, one in early 60s, the other in probably mid to late 60s, who were sitting the exam. So that's a no. You can easily, we never had anyone who's past 70, but definitely we've had candidates who were preparing with us who were in their 60s. So there's no age restriction in these exams. Great. So thank you once again, because I'll have to take your leave because in less than, well, we should have started already. We are going to start another session on FCAI, and feel free to join us. If you don't have the link for that, then we can certainly share it in the chat box here if it's something you are interested to learn about. And it was a pleasure to have you all today, especially on a weekend, sparing all the time from the cricket match. And I wish India all the best in this cricket match, and all the best to you guys as well for your preparation. Have a great weekend, and see you all soon. Bye-bye.